Hello everyone, I am Renu Sati. My topic is mental health and spirituality. Spirituality has received increased attention in the psychiatric literature. However, it remains underexplored on a global level. Knowledge about the spirituality of person with schizophrenia is often hampered by positive and negative symptoms, which limit their expression of spiritual needs and shifted mental health professionals focus from spiritual care to symptom control. Differences in the ways that the two parties understand spirituality may create different expectations and further hinder the provision of high quality holistic care. In recent decades, increased attention has been devoted to psychosocial and spiritual care for mental health rehabilitation. This is in part because advances in pharmacological treatment have improved patient symptoms, control, and functioning, which has allowed more time and opportunities to deal with others. Some patients with mental disorders are discharged from the hospital and even reintegrate into the society. Thus, psychosocial and spiritual support, which can enhance patients' overall functioning and quality of life, are important. While there has been a marked increase in studies generating evidence supporting psychosocial interventions, few studies in the international literature on psychiatric disorders, that is, spirituality and mental health care, have emphasized spiritual care in persons with psychotic disorders. There is documentation in the research literature that spirituality can help patients in the process of illness recovery by facilitating their autonomy and assisting them to live and grow beyond the limitations imposed by their illness. Delgado noted that nurturing spirituality can increase one's inner strength, personal awareness, and acceptance of the world, thereby enhancing the ability to cope with stress, uncertainty, and ambiguity, such as the sudden onset of an illness. Several survey studies and meta-analyses have found that 30 to 90% of people with schizophrenia or severe mental illness regarded spirituality or religion as one of the most essential resources for dealing with difficult, stressful events in the recovery process. Even in the recovery process, most of them claim that half of their time spent on coping was related to spiritual religious practices. However, the abstract and diverse conceptualization of spirituality may impose barriers to the consideration of spiritual issues in clinical practice. Several studies have been conducted to explore mental health professionals' view about the role of spirituality in mental health services.